I'm Professor Fred Binker. I'm a professor of clinical epidemiology at the University of Health and Allied Sciences in Ho, Ghana.
I'm Dr. Richard Makolabi of the Obafemi Awolowo University in Ile-Ife, currently an associate professor of public health.
My name is Dr. Joseph Somua Ekwamwa. I belong to the 1995-96 cohort.
I'm Oluwafunke Elesomi. I'm a medical doctor and an epidemiologist.
Hi, my name is Comfort Oga. I am a pharmacist.
My name is Shola Oresoya. I work currently with Malaria Consortium.
Most of us have the notion of health system as healthcare system, but it goes beyond healthcare system. It's a combination of so many things that come together: good governance, having political will to get things done, human resources, health workforce is a very critical issue as well.
We have to know that we need more people, and the more people will be different from different situations. In the hard to reach communities, we need to deal with the village health workers and train teachers, train health workers, as I continue to say. The problem we have with this whole thing is that we want them to volunteer for life, which is not feasible. We have to find these people, we have to train them, retrain them, get them to provide information, but make sure that everybody can be reached. In the big urban areas, maybe you want doctors, but there must be tax shifting. In this simple tax, we can train these people, we can monitor them, we can give them logistics to do the tests, and they can treat people and put the documents to us. We have the technologies, the SMS, we have the mobile phones and all that can help us to take this forward. So the time is now that we should bring all these people on board, including the mothers of people who are looking after these children. Let's train them, let's license them, let's give them the logistics, and let's supervise them.
As we speak, in a country like Nigeria now, you would find out that in some parts of the country, there are so many doctors, whereas some other parts are depleted. I served in Kogi State, northern Nigeria, northeastern Nigeria, and where I served, there was only one doctor in that whole local government. As a youth corps, I was the second doctor serving a huge population. And you can imagine the amount of work you needed to do. There was a comprehensive health center there was a general hospital there, and we was interchanging between these two facilities all through the year. I dared not go out on a Thursday, which was a market day, because people will come back having sustained accidents on the road. And so it keeps you on your toes all through. This workforce issue is something I think the government needs to look into, because no matter how best you think you are dealing with health, you put infrastructures in place, you put buildings in place, who are the people going to manage this? Because there aren't enough workforce, people would rather go to the quacks, okay? Because the people that are working, the doctors that are employed and all the other workers are poorly motivated, and so they are not able to give their best. Even if all the equipment are there and the buildings are there, and the poorly motivated staff is a very dangerous staff.
For instance, if you want to talk about elimination of malaria, not control, we would need to also identify existing health workers, like laboratory staff, like nurses, like dispensary staff, who are not in the forefront of managing malaria. Retrain them. By so doing, we shall all be helping reduce the burden of malaria. Then we could be moving towards the achievement of the elimination.
In the near future, we're not talking about controlling malaria, which if we continue in that state, we have to do forever. There's opportunity to eliminate malaria on this continent in Africa and within our sub-region. So we all have to get together and believe in the fact that we are ready. The time is here. There'll be other tools to come. But what we have today is enough for us to start the journey to eliminate malaria on the African continent. What needs to be changed is the information and documentation. What has not been documented has not been done. When we get into that mode, many things will change. We can determine where we are coming from and where we are going easily without any sentiments. Facts are facts.
Information is key for you to be able to resource mobilize, for you to be able to make policies, for you to be able to get the demand, because it's not just you putting things in place, but also the demand needs to be generated.
We need to document all these treatments. The days of just saying that somebody has a fever and he has malaria are gone. Now we have to confirm the test, we have to document that, put it in the health information, and be able to chart our progress very adequately.
We don't have funding in viral hepatitis as we speak, and it's basically the fact that we don't have data. Once we have enough data, once we have the awareness, the populace are aware of viral hepatitis, I believe strongly that will be able to help us, to pull together the necessary documentation for fundraising.
The one thing I would change in health, particularly in Nigeria, would be to have health administrators managing the systems rather than having doctors manage the system.
I every day thank God for giving me the opportunity to have studied at the Braun School of Public Health. Because it was essentially the first time I was applying for anything outside of my country, and as God would have it, I got the admission and was there in 2004 to 2005. It was a life-changing experience, and I'm sure all my other colleagues will accept that fact that attending the Braun School of Public Health is a life-changing experience. You can never beat it. The exposure that you get, the interaction with the teachers, their unassuming posture to you, they don't take anything for granted. They just want the best for you. And having finished from that program, I can say that the toolkits that were given to me from the Braun School of Public Health has in no small measure shaped my career. Today I'm an assistant professor of public health. I teach epidemiology, statistics, and environmental health. The tools I took away from the Braun School of Public Health were amazing. And to thank particularly PIS Foundation for bringing us to this forum on a regular basis, because in public health, networking is key. And if you do not network, then it becomes difficult for you to reach out. Even when you are doing great things in your own little domain, if you do not reach out, you are not able to get the best out of it. Braun School of Public Health and PIS Foundation has made it possible for us, alumni, to come together, share our ideas, share thoughts and perspectives. And for this, we are most grateful.
Israel was really intensive. By the time I finished, I knew that my life was never going to be the same again because of the skills that I had gained and the competencies and even the network of people that you could relate to even after school. So Braun School was really an amazing experience for me, and really as soon as I got out of Braun School, I just knew that the sky was no longer the limit in terms of professional achievements and what I could achieve with my life.
The Braun School is unique. Unique because in 1995, when we happened to meet, we were about 21, 22. And we came from different countries. And these are health professionals coming together to be taught epidemiology, statistics, and public health, so that we could also go back to our countries to impact and also contribute to the health delivery of our various countries. And I say the experience of moving and learning with other people from other countries was very tremendous.
This school has made a lot of difference in my life. I was there 31 years ago. I learned the issue about community-oriented primary care. And in Ghana, I have introduced what they call the CHIPS concept, which is a variation of the primary-oriented healthcare. Secondly, they had this follow-up of populations in Kiatiovel at that time, and they were looking at non-communicable diseases where they followed people with cardiovascular disease, hypertension, and so on. I came back and established a similar system in Navrongo. Out of that came the in-depth network, where we brought all the people around the world, in the developing world, who were looking at demographic surveillance. And that has really provided an avenue for us to test many of this. They have been very friendly. They were open. They opened their books and all their research to us. And they've continued to follow our progress over time. And I think this is the most important thing. I really love this idea of bringing alumni together to share some of the work they are doing. And I think we should continue to support them. This will be an inspiration to most people. They will see what others have achieved coming from the same place, and they'll be encouraged. And the networks will definitely allow us an opportunity to be able to help each other and to build our continent.